Hi everyone, welcome to my channel. I am your host Dr. Reena Murmu Nielsen, and in this video I am going to tell you about the 7 symptoms that you cannot or should never ignore. Alright? Sometimes when we feel a little different than usual, say we have a fever or we are feeling pain, we tend to not pay too much attention and we tend to ignore the warning signs and symptoms. In this video, I'm going to tell you when or what type of symptoms that you should never ignore and why, and what you should do to manage these symptoms. Here are the 7 symptoms that you should never ignore. Number 1, abdominal pain. Now, abdominal pain is diverse, and the seriousness of this depends on the type of symptoms that it is accompanied with. Now, if you have an abdominal pain that is accompanied only by gas, then it's a simple constipation which would go away by using over-the-counter anti-gas laxatives. However, if you have an abdominal pain that is accompanied with nausea, fever and vomiting, your condition is more serious. It could be appendicitis, and appendicitis has to be treated as soon as possible. Otherwise, it's going to get ruptured and the infected fluid is going to spread to other parts of your body. Okay? So see your doctor or call your doctor immediately. Now, if you have an abdominal pain that you feel is radiating to other parts of your body, it could be gallstone or gallbladder infection, kidney stone, or colon disorder. Also, see or call your doctor as soon as possible. Symptom number 2, blood in stool. Now, if you have a bright red or maroon stool, together with pain and pressure, it could be hemorrhoids. In that case, over-the-counter cream would help. But if your symptoms persist for long, call your doctor. Now, if you have a bright red stool, together with pain, pressure, gas, constipation, or diarrhea, your condition is more serious. It could be something called a Crohn's disease, which is inflammation of your digestive tract. It could be a tumor, or it could be benign or cancerous polyp. See your doctor immediately, who would suggest diagnostic test. Now, if you have blood in stool, together with burning in stomach, it could be an ulcer. Also see your doctor as soon as possible, who might suggest endoscopy. Symptom number 3, blood in urine. If you have blood in urine after starting a new medication, it could be the side effect of that drug, aspirin, cancer medicine, or other kind of antibiotics. See your doctor immediately and talk about it. Now, if you have blood in urine together with fever and back pain, it could be kidney infection or kidney stone. If it's an infection, your doctor may suggest antibiotics. If it's a kidney stone, your doctor would suggest surgery to remove the kidney stone. If you have unexplained blood in urine with no additional symptoms, it could be a gallbladder cancer, kidney cancer, or other genetic disorder. See your doctor, call your doctor, and talk about it immediately. Now, if you have blood in urine together with difficulty while urinating, it could be a urinary tract infection, and your doctor would suggest you some antibiotics or to take a lot of liquids to get rid of the infection. Now, if you are a man and you have blood in urine together with difficulty during urinating, it could be a prostate gland enlargement. See your doctor, who would suggest medication or surgery, so laser-induced surgery to remove your excess prostate gland. Now, symptom number 4 that you should never ignore is diarrhea. If you have a sudden diarrhea with no apparent reason, it could be a viral infection, and it normally goes away in a day or 2. If you have a diarrhea right after eating a food, then it could be a food allergy. Take that food item off your diet. Now, if you have a diarrhea 2 to 6 hours after eating a food, it could be a bacterial infection. caused due to uncooked, spoiled, or contaminated food. Cook or handle your food properly and thoroughly, and never eat expired or spoiled food. Okay? Now, if you have a diarrhea for a very long time, say about 4 weeks, then your condition is very serious. It could be a Crohn's disease, like I mentioned before, inflammation of your digestive tract. It could be lactose intolerance, or it could be irritable bowel syndrome. See your doctor immediately. All right? Now, symptom number 5 that you should never ignore: fever. Our normal body temperature is 37 degrees Celsius or 98 degrees Fahrenheit. A mild increase in the body temperature is normal, say after exercise or during menstruation in women, or due to wearing too much clothes. However, if your body temperature raises between 100 to 104 degrees Fahrenheit or 38 to 40 degrees Celsius, together with nasal discharge, throat infection, you may have cold or flu, ear infection, throat infection, or bronchitis. If your fever does not go away within 3 days, or if it lasts for 3 days, see your doctor. Now, if you have a high fever accompanied with confusion, stiff neck, shortness of breath, or hallucination, it could be viral or bacterial infection or kidney infection. You should also see your doctor immediately. Now, if you have a fever together with unexplained weight loss, pain in your muscles and in your joints and in your stomach, then it could be a variety of conditions: HIV, AIDS, autoimmune disease, cancer, etc. See your doctor as soon as possible. Symptom number 6 that you should never ignore: chronic cough. Now, if you had a cough that's accompanied with nasal discharge and repeated throat clearing, which means that you have the urge to clear your throat repeatedly, it could be allergy or sinus infection. See your doctor, who may suggest taking allergic medication. If you have a nighttime cough with rattling or wheezing sound, it could be asthma. See your doctor, who would suggest bronchodilator. Now, if you have a cough that becomes worse with time and is accompanied with fatigue, shortness of breath, or chest pain, it could be lung cancer. See your doctor as soon as possible. If you have a dry cough that's accompanied with shortness of breath, it could be a lung disease, a condition known as obstructive pulmonary disease. Also see your doctor immediately, who may suggest additional or some diagnostic test. Now, the last symptoms that you should never ignore is chest pain. Now, if you have a squeezing, tightening pain around your breastbone that you feel is radiating to your jaws, your teeth, or your back, it could be the sign of heart attack, something called angina. Call 911 or your doctor immediately. Now, if you have a chest pain that becomes worse every time you cough or with deep breathing, you could be having pneumonia, inflammation of your lung, or collapsed lung. Also see your doctor immediately, who would do X-ray of your chest or do some tests to check the capacity of your lung. Now, if you have a chest pain together with burning sensation and other GI symptoms such as reflux, it could be ulcer, pancreatic disease, or some other disorders. See your doctor immediately or as soon as possible. Now, if you have a mild chest pain together with shortness of breath, it could be that you are having a panic attack. In this case, deep breathing technique would help. I've made a video on this technique which will help you calm down and relax in a stressful situation, say right before a job interview or right before you have to present in front of a large crowd or in front of your colleagues. You do this exercise, it's going to help you calm down. So if you want to know more about this video, click the suggested link. Thank you all so much for watching this video. Please do not forget to like, comment, share, or most importantly, subscribe to my YouTube channel so that I'm able to produce and deliver interesting videos like this. See you real soon. Bye for now.